Namaste. I,
Namaskar.
Dr. Bharti Rajshekhar, take immense pleasure in inviting our beloved President, Dr. Sunita Tandulwadkar, to this 109th podcast, which is truly a great achievement in the annals of history of the Federation of Obstetrics and Gynecological Societies of India. And to share his views on how we can build a stronger nation or a stronger human race, we have our eminent Dr. M.A. Shekhar, who is known as, especially in the diabetology sector, known globally as well as nationally, and heads a very important post as the Vice Chancellor of the Adi University at Bellur, Mandya. So Dr. Sunita Tandulwadkar, to give you a brief introduction, Dr. M.A. Shekhar, words cannot explain in the short time, but I will just make it short because Madam always tells us don't waste time with me. Please speak to the invited guest. So Dr. Sunita Tandulwadkar, soon as she took up her presidential tenure, much before that she has put across a few revolutionary, I would say, projects which are really very, very useful. For example, this podcast is conducted by 30 of our committee chairpersons every single day from 8 o'clock to 9 o'clock. It's called the Gyan Pravah, and where Dr. Sunita ji has told us you can invite any person from any field where they have made a mark, where they are legends, and they talk about what has made the impact in their life or how they could make an impact in somebody else's life and in society. And along with that, she has started a Know Your Number scheme where we want every Indian to know their numbers. That is not the 26, 34, 36 that we talk about, but the numbers of hemoglobin. What is their hemoglobin? What is their weight? What is their height? What is their blood glucose level? And if possible, what is their thyroid levels? So they know their health. These numbers they need to know. Along with this, we have CMEs. Madam has said we will reduce the number of webinars and we will go for physical CMEs where we are focusing on preconceptional care, nutrition in women, because these are the things I think we can prevent disease and promote wellness. So over to you, Dr. Sunita ji, for your kind words.
Thank you, Bharti. Welcome, Shekhar sir. It's an honor to have you on a Fogsi platform. And Bharti, as a state president, I observed very closely. You were doing amazing. And you did not mention our cervical cancer Mukta Bharat because you yourself is doing so much on cervical cancer vaccination, giving free vaccines to everyone. So that's another our flagship program, which you are doing great in your state. So Dr. Shekhar, today we will be joining. Now, after your introduction, I'll join from another link, the viewers link, and I will have a pleasure of enjoying the dialogue between both of you. This podcast I started for the chairpersons, thinking that they are my future leader of Fogsi. They will evolve with every interviewer because they take the person of that category. So naturally, they prepare a lot, their vocabulary, everything, their knowledge. But believe me, with these 100 podcasts, what I realized is I am evolving as a person. Every day, 8 p.m., if you meet someone of national or international who has given an impact in academic or non-academic field, it's so much to learn from every individual. And I think as an individual, I evolved every day by listening this podcast 8 p.m. to 9 p.m. It's really, I'm enjoying, and that's a huge data we are collecting at the Fogsi level. I don't know what we will do with that, but definitely we'll do something with these podcasts. So thank you, Bharti. Thank you for having one of the best faculty with us. Yeah. And I'm sure this podcast will be the great podcast.
We salute your dedication and your ever lasting enthusiasm in making this world a much better place. Thank you, Dr. Sunita ma'am, for being here. And of course, to introduce Dr. M.A. Shekhar, well, as Dr. Sunita, he is also a person who has attained great heights and great accolades. But just to make the long story short, Dr. M.A. Shekhar is son of the eminent senior most pediatrician of our state, Dr. Anke Goda, who is a luminary on his own. And Dr. Shekhar has a wonderful lineage of music, culture, and theatrics in his bloodline. He happens to be the great grandson of Sri T. Chaudaya, who was a violinist and of international fame. And madam, if you come to Bangalore, there is a Fidel Chaudaya Memorial Hall, which is shaped like a fiddle. The whole building is shaped like he happens to be his great grandson, and he has theatrics in his blood because our very, very popular film cine star of Kannada, Ambarish, was also a politician, happens to be his maternal uncle. So, and of course, he's a happily married man with 2 children. But let us come to his academic pursuits. He has won various awards, like, for example, a few, the Dr. P.C. Roy Award. He has delivered various orations in national and international forums, and he has got a professional experience as he has set up his own diabetic center in Mysore called Apurva. And he now, right now, is the Vice Chancellor of the Adi Chunchanagiri University, which has medical colleges, dental colleges, and Ayurvedic and all other fraternity like engineering and paramedic courses. And he has been the director of the Karnataka Institute of Diabetology and Endocrinology, which is based in Bangalore. And they deal only in diabetes and endocrinology, and they do a lot of research in this. He has presented various papers, and he is in the governing council of the Mysore University, the Rajiv Gandhi University, and his profile runs into pages. So I'm just trying to cut it short because we want to have more interesting discussions as the podcast we will start here. So welcome you, Dr. M.A. Shekhar, to this Fogsi Gyan Pravah, and definitely I know that you are going to enlighten all our listeners on how strong a society can be made. Thank you for being our invited guest.
Thank you, Shekhar sir. Thank you. Lovely to know about you. And I also do have one common interest with you about working for diabetic patients, because my mom was diabetic. And since that time, I'm working with autologous bone marrow therapy for diabetes. I'll definitely come down to Karnataka or Mysore, wherever you are, and we will have a great discussion together, sir. It will be my honor and pleasure to meet you, sir.
Definitely a
Thank
pleasure.
you, madam. That is so nice of you. Definitely, we will invite you, madam. As soon as your busy schedule is slows down, then definitely we will have you to have these very fruitful discussions and taking it forward.
You will take me to him. It's your responsibility.
Sure, definitely, madam. Definitely.
We will come down and meet you, sir.
Definitely.
Thank you so much.
Thank you, madam. Thank you. Thank you. Yeah.
Thanks.
Thank you. So, well, Dr. Shekhar, and now we start. Madam has left and she will be on the delegate link. So, I think the past few days we have seen our Indian society as well as the whole neighborhood in a lot of turmoil. So, and we have seen the strength of our military powers, the strength of our defense mechanism. But now let's see, how can we build a strong nation? Is it just by military forces, or it is just by economic developments? What do you think is the essence of building a strong nation?
Well, thank you for having me for this podcast. When I spoke to Dr. Bharti about how I should present myself, she said, "You be natural." So I'm natural. I'm like a,
Thank you. True.
An aborigine from Africa. I'm sitting in my room. Sorry for whatever the background that is there. It doesn't matter.
Perfect.
It's an informal chat that we are going to have. And she has opened up with a very, very relevant question. How do you build a strong nation? Right. I'm not going to, I will be, in a one-way street of a narrow street where my father had done a lot of work. He used to tell, how do you build a strong nation with the population or the citizens? The answer is education. The answer is strength, physical as well as mental strength, etc., etc. My father used to tell the best way to build a strong nation with people is to take care of the health of adolescent girls.
Excellent.
not everybody. He
Yes.
said, take care of the health of adolescent girls between the age of 7 and 14. You can build a strong nation, because if the child is strong, she will be a strong woman, not just physically as well as mentally and psychologically, and you can have a strong nation. That was the fantastic concept he brought in.
Yeah, a great vision, I would say.
Yeah. When asked, how do you make them very healthy? He said, very simple. I still remember there is a concept called KIS principle in psychology. KIS principle stands for keep it simple.
Okay. That's, yeah.
He added one more to it called as KISS principle, nothing to do with kiss.
Okay. But very catchy word.
Yeah. Keep it simple, stupid.
Okay.
Is it stupid here?
You.
Yes, exactly. So keep it simple, stupid was his slogan. And he said, to improve the health of an adolescent girl, or even a boy for that matter, you don't require a lot of money, you don't require a lot of intelligence, etc. All you need is common sense. He said, groundnut, which is easily available, peanuts or groundnuts,
True.
good amount of milk, 150 to 2 ml minimum, 200 ml minimum, and good in Hindi, what you say, and jaggery
Good.
in English.
Yes.
3 complements: milk, groundnuts, jaggery, and add an egg if they are non-vegetarians or flexitarians. That would take care of most of their requirements.
True.
This is how it started.
Yeah.
So I remember my father telling this: to build a strong nation with people, take care of the health of the adolescent girls. The rest follow.
Will follow. Yeah. As you said, the child of today is the father of tomorrow. So that way, and your father's vision of incorporating, see, iron deficiency anemia is a burning problem in our country today. The other thing is protein malnutrition and its associated non-communicable diseases because of the infection, and then the infections because of the poor resistance. So all these get covered when they take a cup of milk, a handful or a fistful of peanuts, and a piece of jaggery and an egg if they want. And this is easily available for anybody in our country, I would say. Even in the lowest of the economic situations, they can definitely afford this, because it would be just about maybe within less than 10 to 15 rupees a day. It wouldn't be much more than that. So I think that is what we all need to think about if we are going to promote wellness and build a strong nation and have our boys and girls step into parenthood or step into adulthood on a very strong foundation. So we have to see that our foundations are strong. So taking this forward, Dr. Shekhar, you know that today we are sitting on this tsunami of diabetes. And of course, the topic of today, which you have very well chosen, is what is the fetal origin of these adult diseases? So could you please enlighten us on this?
Okay, let me have a preamble for this. I gave an oration lecture some time ago. The topic was lifespan versus health span.
Okay, yeah.
I just mentioned a very scary word, tsunami.
Yes.
Creates havoc and created havoc all over the world. The tsunami of so-called non-communicable diseases and diabetes, the simple answer is in this lifespan versus health span. When our country got independence, the average lifespan of an Indian was about 40 years.
Yes.
Most of the Indians would be dead by the
50,
time
60, yeah.
40. They used to be very healthy till then. So we did not worry much about genetics and this and all that. Why did they die? Not because of non-communicable diseases,
yes,
but because of infections.
Yes.
Down the road in the last 70 years, what we have done, we have effectively controlled communicable diseases and allowed them to live longer. But unfortunately, today, the lifespan is about 70 years or something. So 30 years have been added, but health span is dropped.
Yes, true, very true.
The time our average Indian is 50 or 55, they have diabetes, they have hypertension, they have this.
The whole bundle. They have the whole bundle with them.
Right?
Yes.
So by the time they are 60, their neurons are not firing right, their eyes are not okay, their heart is failing, etc. By the time they're 62, kidney dysfunction, heart dysfunction, they suffer for 8 to 10 years before they die.
It's like the living dead. It's like a living dead person.
Exactly. So the first step I told in my oration lecture is to improve the health span. We'll not look at how to save a life. We look at how to save a life and improve
Healthy.
the
Keep them
quality.
healthy. Yes, quality.
For this, we have, if you ask me, I should not be using this word, we have wasted time looking at why we get disease. Pathogenesis. You remember?
Yes.
Why we get disease was 400, 500 years of modern medicine. Modern medicine, if you ask me, has really wasted a lot of time on just looking at why human beings become diseased.
Yes.
But there is a concept in Ayurveda, in spite of disease-causing environment, water is not okay, air is not okay, food we are eating is not enough. Why we are healthy?
Okay, yeah.
Can you see the paradigm?
Yes.
Why are we diseased? Why are we healthy even with the disease-forming environment? With this, in the 60s, one social psychologist, Israeli-American, Antonov, gave the word salutogenesis.
Okay.
Word salutogenesis stands for how to maintain health in spite of disease-forming environment. And this is the crux today. If we can do that,
if you can maintain your health. Yeah.
Now coming to, we have spent plenty of time on why we become a diabetic. The immediate answer, even a illiterate tells you, sir, my father had, my parents had, my grandparents. So genetics. The denominator in all this so-called pathogenesis is genetics.
Genetic.
But why some brothers develop it
and some don't?
And some sisters and brothers don't? Because they come from the same genetic pool. They must have been eating the same food for a long time, but some, and you have the whole story.
Yeah.
Sedentary activity, obesity, blah, 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 blah. But this paradigm that happened in the 60s was, they looked back into the womb,
where it all started.
Or conceived. Do we get, programmed when we are born and when we start becoming older to become diabetic, have hypertension. This is called as fetal origin of adult disease. So I was joking, in fact, I have given an oration on this also. I was joking, ladies and gentlemen, the most important person in your life. The question I asked them was, the most important person in our life. They said, my husband, my wife, my children.
Nobody said.
Some of them slowly said, my mother.
Yeah, the most important person.
We all say the most important person in our life is the mother.
Should be the mother.
You blame your mother for your life.
Take her for granted.
I said. Some of them were very angry with me. I told them, don't get angry. I was just joking. It is blame the mother, but not the mother who gives you the trouble. It is the environment, unfortunately, these young mothers go through,
Yes.
Ask me, in fact, I'm married for 37, 38 years. You are 39, right?
41.
41, my God, you're old. I've come to understand. First 10 years, I thought I was the king of the family. Next 10 years, I started getting doubt. Probably I only know how to earn. Last 10, 20 years, I know my wife is the leader.
Lord in the house.
They do so much. But they sacrifice their health for the family. So this is it. A young woman who sacrifices her health by eating less and giving it to others, when she conceives, the fetus gets into trouble. Sure. This is the simple concept of fetal origin of adult disease.
So,
some more?
So as you said, yes. So you said this fetal origin is, all of us are familiar that yes, now we have to start with good adolescent health care, and preconception care does not start just before they get pregnant, because most of them do not come to us for preconception care. I think this is where, as you said, we have to focus on the adolescents. So when the adolescents are healthy, they enter adulthood, and then they enter parenthood. So now it has to be a paradigm shift from, it's not saying a healthy mother, it has to be a healthy woman. A healthy woman will beget a healthy child. So we need to move more towards the younger age group to focus and prevent fetal origin of adult disease. So taking this forward in pregnant mothers or to-be mothers or to-be couples, how do you think we as clinicians could contribute to preventing this transgenerational or intergenerational transmission of fetal origin of adult disease? What do you think would be the few sustainable methods we could follow?
Right. Let me digress a little bit here. I remember Time magazine, one of the most popular magazines way back, had, how do I say, the front cover was how the first 9 months can shape the rest of your life. It started like that. And from there, we have so many things that has happened. You should know, I know, everybody knows, we cannot choose our parents.
Yes.
So we are already being blighted with the genetics that come from our parents. But how can we go through this activity of not allowing this so-called genetic material that has been transmitted from the mother and the father from not becoming a parent? That's the question, right? That's the $1 million question, which we have not been able to answer. But we have come across with a lot of funny, ideas. I put in quotations, funny ideas.
Funny ideas, okay.
Right?
Yeah.
Let's look back. Before I say operative measures or how can we prevent in an adult when that particular adult was a fetus in the mother's womb.
Neutral.
There have been some concepts that have been brought in and which is very, very typical. I must tell you, Mission Hospital, Holdsworth Memorial Hospital in Mysore, was a part of this multi-center activity in the 60s, 50s and 60s.
Wonderful.
And at that time, when they did that study, they said small for dead children, a newborn less than 2.5 kilos has a lot of risk.
Yes.
We talked about obesity in children, but they talked about
the neurodevelopment,
malnutrition or undernutrition in newborns. Why? Because it's called as Barker's hypothesis.
Yes.
David Barker was the principal investigator. He did it. Barker and Hale hypothesis, they say, when there is less nutrition from the mother to the fetus tries to survive. Whatever that is happening. So it brings down the non-vital organs for survival inside the womb. Like kidneys, the heart, probably the brain. So it gives more importance to the liver to metabolize and all. And brings down the skeletal mass. You get the idea.
Muscle mass and
So at the end of the day, when there is less nutrition for the fetus, it fights to survive by becoming less or smaller in nature. And when they are born, they don't have any disease.
Yes, they're just small.
As they grow older, they already have a template of smaller kidney, smaller heart, smaller blah, blah, blah. And when they can afford to eat more, they put on weight. What is that weight gain? It is fat.
Fat.
Not a
it's not muscle. It's not muscle mass.
That fat that they put on starts the process of your so-called
diabetes and other non-metabolic syndrome. The metabolic syndrome.
And this is one of the reasons why South Asians, especially Indians, they get diabetes 10, 15 years before the counterpart.
The other parts.
Their birth weight is 3.5 kgs. Our birth weight at that time was 2.5 kgs.
And even now, average is around 2.8 to 3.2. The moment it's 3.5, like the people say it's a big baby, or probably because of ethnic variation.
One, called as phenotype concept, phenotyping.
Yeah.
So genotyping concept, by, they said, you remember India went through huge amount of famine through
starvation. Yes, they had
So
Pre and post independent, there was a huge duration
much
of
earlier
duration.
in
Yes,
our
yes,
so-called evolution,
true. They had no food grains. Food grains
yeah,
were not available.
available.
I remember
What happened? There
rice
was
was not available. They had to eat jowar, which was maize, which was exported from US to India, and there was a lot of infections at that time. It's a very
right.
bad time. Yes,
Remember that not at pre-independence. I'm
post
talking hundreds
before
of
that.
years.
Yes.
I mean, throughout their life. So down the road, they developed a genetic dysfunction in the sense they had a gene mutation that
Okay.
preserved the
Huh.
energy. When there
Okay.
was food, they would eat and
So,
preserve that energy. When there was no food, they would take it out.
okay,
That's
fine.
why Asians have a big thumb.
Okay, that is
Compared to Caucasian, because when there is less food, what do you do?
yeah. You
Visceral
eat.
fat, not
You try to utilize what you have.
right. That is the genotypic concept
Oh,
for
this was something interesting I never knew. I had not heard about this. Very interesting.
this is phenotyping and genotyping. So
Genotype.
and
Okay.
we went through all this.
Huh.
Gene did not become dead. It
Then
became
it was
poison.
there. It was poisoned. Huh.
Thus, our mothers started getting good enough food. Our fetuses became 3 kgs, 3.2 kgs. But when
Healthier.
on, they still had that genetic dysfunction. And they ate more as they grew older. This gene was,
Becoming active.
that's the reason.
Active.
These are the concepts, and there are many more epigenetics and things like that.
Okay. Yeah.
And if anybody is interested, genetics I have spoken about. The epigenetics part is whatever you do in your life, food, breathe, exercise, and all that. The nurture part, nature was.
Yeah, that's what we wanted to. I wanted to ask you about that. So, what do you mean by this epigenetic influence, and what is the role of nature versus the nurture?
Nature, I've just mentioned about
Yes,
phenotyping,
and yeah,
about genetic
yeah,
predisposition. Nurture part is fantastically in the 70s, there was a, how do I say, eye opener clinical trial that was done called as Asiatic cousin study. They
okay.
took Indian cousin and another cousin who had, our brother who had migrated to America.
The West, to the West.
Indian fellow did not develop hypertension. The American fellow developed.
Okay, okay.
That's the, initiation of
Huh.
what is called as epigenetics.
Huh.
For epigenetics, there are plenty,
Factors.
mechanism. The simplest is DNA modification.
Okay.
Methylation of DNA,
Mhm.
then change in the DNA activity, which gene has to be quiescent, it becomes active. The gene that has to keep active becomes quiescent.
Becomes quiescent.
That is epigenetics. For that,
Yeah.
the nurture part of it, the way the parents take care of the children, the way
The
they take
lifestyle.
care of the students in the school, the way friends are with each other. It's the simple concept of it.
Yeah. So, does lifestyle play a major factor in these epigenetic modifications?
What is lifestyle?
So, well, lifestyle, we would like, it could be your social health, the food you eat, what are your what activities do you do, like your to maintain your physical health, and what activities you're doing to maintain your mental health, and what are the factors which are influencing. So, lifestyle could be, I'm not talking about your social lifestyle more. I would say it's your personal lifestyle. So,
Right.
what is your sleep pattern? What is your food pattern? What is your exercise pattern? What are the mental health programs you're doing to keep yourself alert? So, do these play a factor in these epigenetic modifications?
I tell you, I always, tell our postgraduates and undergraduates to be a little bit careful with using the so-called phrases.
Yeah.
Mentioned about lifestyle.
Huh.
Tell them, do lifestyle matter? Yes, it's a small question, but abnormal lifestyle matters.
Yes, not regular.
Lifestyle is how you live. How you live in a rightful manner. Do you get diabetes? You don't. How you live without all this care and thing that I mentioned, it becomes. So lifestyle has 3 components. Everybody knows about it, right? Diet, exercise, stress, or as you said, mental
Mental
health.
health.
If you remember, I'm sorry, please don't take me in the wrong sense. I will be oftentimes, referring Ayurveda because it's a great science.
No. That is how we have to integrate. See,
Integrate.
we have to be proponents of all the systems of medicine because there is good in everything. So we need to take the good that is there in everything, and we have to integrate whatever is in Ayurveda into the allopathy. And I think that's how we can get a holistic approach to management and preventing illness and promoting wellness. That's what I always believe in, promoting wellness. So I always say I want you people to be well, not ill. And Ayurveda, I think, plays a major role in that.
It's pathogenesis litigants, as mentioned.
Yeah.
We harp about diet, exercise, stress, right? For the last 60, 70 years. But Ayurveda, long time ago, said ahara, vihara, vichara.
Yes, that is the basis. That is that basis.
So I have, brought it down to a very simple activity. Diet, exercise, and stress. Let's look at stress, the so-called lifestyle we are talking about. What is the definition of stress? If I ask many people, they say anger, frustration, whatever things that they say. But they have forgotten in physiology, they have studied stress in a different manner.
Yes.
And Selye, Selye's concept of flight or fight.
Fight or fight.
The stress mechanism for survival.
Yes.
The second one is milieu interior of Claude Bernard. How you maintain homeostasis.
Homeostasis. Yeah. Homeostasis has to be maintained.
Right. So stress in physiology is defined as an internal response, hormonal or otherwise, to any stimuli.
External stimuli.
Whatever stimuli.
Yeah.
So next question I ask my patients and my housewives, whoever comes to this thing. Do you love your children and husband and wife? What, sir? Do you think it is stress? They say, no, sir. Do you hate your work? Do you hate your colleague? Yes, sir, I'm very frustrated. Do you think it's stress? Yes, sir.
Yes.
Then I tell them, both are stresses.
Yes.
Stress has two components.
Yeah, loving and hating. Love and hate.
That is good.
Both are stress.
Right. So simple way of managing stress is try to like more than hate and frustrate yourself less.
Very excellent.
To talk, but start practicing. It will bring down stress.
No, if not love, I said at least stop reacting.
Okay.
You can even make your reaction subtle. As you said, immediately to love everything and think it may be a little difficult, but instead of hating, just don't react.
Very true. That's a simple thing. The second thing about exercise, I keep joking about this to especially middle-aged females who come as patients. I tell them, you must exercise. Sir, where is the time, sir?
Yes.
5 o'clock I get up. 6 o'clock my first daughter is ready for
tuition.
7:30 my second son wakes up. I have to get him ready for the school. At 7:30, 8 o'clock my third son, my husband wakes up. I have to cook food, etc. By the time it's 3 o'clock, my second son is back. 4 o'clock, 5 o'clock, my first daughter is back. Where is the time?
True.
So this is a simple, practical problem that I face. Lifestyle we talk about very easily.
Yeah.
But give practical solutions. I tell them, in Kannada we say, Bhagavanta kal kotta.
Yes.
Bhagavanta kai kotta. People.
Yes, there's a song, very famous song is there.
If you believe in superpower, the superpower or God gave us legs to walk.
Walk around.
A simple walk. Where most of these women, they watch TV.
Yes.
One serial is 30 minutes. Two serial is 1 hour. Every day they can walk. Simple walk.
In front of the television.
Instead of buying 3,000-4,000 rupees worth of a shoe, 3,000 rupees worth of track suits and scents because they smell.
No, and what about the lack of rupees treadmills?
Treadmills and things.
Everything gathering dust in most of the homes.
So this is a simple concept. KISS principle, you remember?
Yeah.
Plus, KISS principle is like more.
Keep it simple.
Keep it simple. Stupid.
I know. I'll cut the second S.
Okay. And now diet part of it. It's very easy. First, we should understand, I plead with young doctors, please understand definitions of what you have studied. How do you define nutrition and diet? It's very simple. Nutrition is what we should eat,
Yes.
the balanced diet or whatever. Diet is what we eat.
Yeah.
So you have nutritionists and you have dietitians. Dietitians give you 6 a.m., 8 a.m.,
Grams.
7 a.m.,
And
blah, blah,
grams.
blah, blah, blah.
Grams.
Nutritionists tell you what to eat. I have made it very simple. Diet is defined as ethnic specific, region specific, food that you eat. Very simple. Ethnic specific, region specific, food.
So what I make it, may I interrupt? I say regional, seasonal, and traditional. Nothing much.
Fine.
Whatever is available. Don't eat quinoa because somebody in Mexico is growing it. You eat your regular rice, what is grown in Mandya or Mysore. Eat your papaya and banana, which is grown here. You don't need the apples from Himachal.
Absolutely.
So regional, the same thing. It translates to the same thing as you say.
And next is 3 question answer to diet. When to eat, what to eat, how much to eat.
How much to
Giving
eat.
them 2 idlis bar.
I know, yeah.
Tell them when to eat. It's very simple. 3 times a day is good enough.
Yes.
What to eat, eat normally. What not to eat is more important.
Yes, true.
I'm not going to tell what not to eat here.
Hmm.
Last is how much.
How much?
They go to a marriage, they eat all those things, come back and they're guilty. For the next 2-3 days, they don't eat.
Yeah.
So I just convince them when to eat, what to eat,
How much to eat.
Diet. So 3 question answered for diet, 1 question answered for exercise, and 1 question answers for stress is normal lifestyle advice. Abnormal, when you don't do all this, that leads to
Yes.
all those.
All the stress factors cause the generational influences on your quiescent genes which are lying dormant there. So that's when the disease manifests. And that's the reason, as you said, it manifests in some and doesn't manifest, or the severity is different among own siblings, though they carry the same genotypic genotypes from the parents. So now, as we were talking about,
don't have the same.
Yeah, as you said, diet, not diet, nutrition. So as you said, this ethnic, eat the regular food, what you have. So because as you said, most of these fancy food charts we provide, the nutritionist provides, it's very difficult for people in our urban and rural and semi-rural areas. We should tell them what do they have on their plate when they go home. They may have just a ball or ragi ball. They must be just having some greens. So we need to tell them how much of that they should eat and when they should eat. I think we should keep it simple, as you said. It's a very, very good tagline, which I'm going to borrow from you now and use it in my profession hereafter. So coming to food and nutrition, the present generation with the economic developments and all the Swiggies and Zomatos all over the town. We're always talking about, when we talk about nutrition, this tagline is always, don't eat junk food. For example, a pregnant mother comes, or a to-be pregnant mother comes, or an adolescent comes with PCOS, we will say, keep them away from junk food. So what is this junk food? And why do you think it's dangerous? And what are the modifications?
Wow. If I answer this, young people will be very angry with me. You are telling us not to eat junk food. Let's look at what is junk food. Okay? For example, pizza, a burger, if it's non-veg or veg burger.
Yes.
You know the components?
Most of it is processed, refined food.
That is the junk part of it.
Yes.
The bread part of it, the vegetables part of it, the meat part of it, etc., etc. They are not junk foods.
Exactly.
It is the ultra processing of these things by using chemicals and whatnot that makes it a junk food. And in America, junk foods are cheaper than nutritious foods.
Very true.
But in India, junk foods are costly. Natural foods are cheaper. So our so-called yuppies, young upwardly mobile people think that by eating costly foods,
expensive food, yes,
they are going to be healthy enough. That's
richer in health.
So I keep telling younger people, when a daughter or a son brings his or her mother or father for consultation, I tell them, do you eat junk food? They look at their parents. I tell them, please do. But the junk part of it, this is a Do this pizza and burger at home. Eat.
Yes.
No problem.
So yeah, so do away with these unsaturated fats and try to use your trans fats or your monosaturated fats will help.
No, see, this is where he told me, you should look at, what did you say? Traditional,
Yeah,
seasonal,
regional.
regional,
Yes.
right?
Yeah.
Now, what is the regional oil you get in Hassan?
It has to be groundnut.
Everybody talks about 800,000 rupees worth of olive oil.
Olive oil. Well, that's what I'm saying.
This is the wrong thing.
Yes, we have to use groundnut oil.
You look at medicine, the distilled knowledge of medicine is you should eat 1:1:1 oil. One saturated, one monounsaturated, one polyunsaturated. Saturated is ghee. Monounsaturated is
the
groundnut
butter.
oil. Polyunsaturated is safflower.
So you give up, yeah.
So I tell my patients, you can have all the three oils. Coconut oil saturated, but it's good.
Yes.
But only coconut oil,
yes,
so I tell them when it comes to oil, same formula of when to eat, what oil to eat, and how much to eat. But when it comes to fats, I give stress on how much to eat.
Yes.
I tell them 500 ml per month. They look at me shocked. Sir, is it per week or per month? That is the way you have to, rule of thumb.
Yes.
Oil. Which oil you eat, it doesn't matter. But see to it that you have balance, poly, mono, and saturated.
Yeah, I think this is a very important aspect because very many people in our region, or I would say in India, because ghee is definitely a good component of our nutrition. But unfortunately, due to various influences, people have started talking that ghee is not good for you. Butter is not good for you. I think this is a very wrong concept. And I think this is where, as you said, we need to spend a few minutes with our women or men who come to us and tell them why ghee is good for you, why coconut oil can be used, and why groundnut oil. As you said, the fancy olive oils and all things are probably for that region where olives are grown. We don't grow olives. We only grow coconuts and groundnuts.
They have olive oils, they eat it.
Yes, we grow coconuts and groundnuts. So that's what God has made us for. So I think this concept, and of course, as you said, preparing your junk food at home. You can always make your noodles at home. You can make your pizzas at home.
Ultra process, not junk food.
Yeah, without junk food in the sense use those ingredients which do not contain the ultra refined food. So you can always modify them, and it'll taste much better. It is good on your pocket and good on your body and health also.
But let me tell you, some of the youngsters, they said, sir, doctor, if I order on Swiggy, what's that? Swiggy?
2 minutes, huh? Swiggy.
Swiggy or Zomato, in 10-15 minutes, I get it. Make it, I take 3 hours, 2 hours. Where is the time, sir?
But I think
the ingredients ready.
Yeah.
Whenever you feel like it, you can make it in 10 minutes.
Exactly. They can keep it ready. And once they enter the kitchen, because most, the women and earlier I would say men, now I say most individuals in India don't enter the kitchen. Very unfortunate. No, they say Swiggy hai na, Zomato hai na, even housewives for that matter. But once you get into the kitchen, it's not rocket science. It just not even takes you an hour if you're ready with the ingredients. It's just that the will and the concept that you're looking at yourself, it's for yourself that you're doing and looking forward to that is what has to change. And
the practicality part of it, when both husband and wife are working from morning till evening, especially in a place like Bangalore, Delhi, where they have to travel 3-4 hours to go to their work, 5-8 hours of work and come back. Where is the time to cook? So they say we have no other choice, sir. We have to order, take out or whatever they want to call it as. This, I tell them, you have Rotary, you have all those social clubs and things like that. You have female, male, all those people.
Yeah.
Talk about this and see that the people who make this food for you take out, they have the concept of healthy foods.
Yeah, they have to change the concept.
The burger that is cooked in a hotel, they should know what is healthy part of it.
Yeah. No, I think there are few outlets which have come out. I think even in Mysore, I haven't been to them. I just read them, but they do talk about home cooking and they talk about healthy cooking. I think there is a small transformation, a small wave starting up somewhere down the line, and which maybe gradually will seep in to this younger population when they realize. Because you know that, as you said, lifespan is not important, health span is important. And when you see present day situation, with all the stress of that lifestyle, is working hours, irregular working hours, and all that, we are seeing young girls and boys at the age of 20, 21, 22, hypertension, diabetes, which is very, very shocking and alarming. So I think it's a time for all of them to have a wake up call. And maybe as clinicians, as you and me, we need to speak more about this and talk about it in more forums. And the academic bodies, professional bodies like Fogsi or diabetic associations, the IDA, ADA, all of us have to start talking about, as you said, no, about wellness. Because very often you were mentioning to me today morning that most of us are only talking about how to treat diabetes or how to treat hypertension when we go for our. But what about how can we do this without any? I mean, stop stepping into that shoe of diabetes and hypertension. How can we prevent? This will be the last question and the last word for you.
Prevention, I told you, primordial.
Yes.
We come back to fetal origin.
Yes.
Very simple. The fetus doesn't need lot of nutrients. You remember first 3 months?
Yes.
It doesn't need a lot of nutrients, but it
With
needs
that duration.
balanced nutrient.
Exactly.
Nutrition you mentioned. I ask this question to patients and doctors. What is nutrition? They say protein, fat, etc., etc.
Yes, yes.
You should know there are 6 components to nutrition: proteins, fats, carbohydrates, vitamins, and minerals. And the 6th one?
Water.
This is very important. So the fetus needs all these 6 at a much lower this thing. How do you do that? 20% more than what the mother requires is more than enough for her.
Yes.
That everybody should start telling when they look at a 20-year-old, 22-year-old girl, woman, continue to put it in their mind, repeated reinforcement. By the time they get married, they know what to eat, how much to eat, etc.
Very true.
So unless we educate our young people, especially the young females, we are not going to change.
Yeah.
This is the first prevention active, primordial. Primary prevention. Now you have parents and grandparents who are diabetics and you are born and you are 15, 20 years old, you need not put on weight. You be active. Don't get into alcoholism and smoking. Plus, like what you do.
Yes.
Simple concepts, 4 or 5. Be active. Don't put on weight. Eat the so-called nutrition I just mentioned about when to, what to, how much. Next, like what you do.
And that's very important. Like what you do. I think this even the parents need to realize, because that is also causing a lot of health issues in the younger generations. Because they are not allowed to do what they like.
I tell you, Bharti, it's very easy for us to talk and tell them, say, paternalistic way of telling them, you do what I say. When it comes to living, I remember when I started diabetes practice 38 years ago, one of the early patients I had was an Indian civil service retiree.
Okay.
Before independence, it was civil services. He was a Tamilian, settled down in Mysore. He came to me because he thought I'm a good doctor. As usual, I was very young. I told him, don't do this, don't do that, blah, 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 blah. And he said, stop, doctor. I'll tell you 2 things. The first one is, you have told me not to do so many things. Why didn't you ask me to stop breathing? Shocking. Second one, he said, Dr. Shekhar, do you have diabetes? Got angry. I'm young. So, how dare you talk to me like this? Then you do not know much about diabetes. What he said was, doctor, I spent 10, 15 minutes with you, another 15, 20 minutes with friends, another 30 minutes walking. But the rest of the 20 hours I have to spend with myself.
With myself.
So 24 hours I spend myself. I spend my time with myself. Unless I get it into my mind,
I will not do it. I will not do it.
Not be able to control. Please don't tell me what not to do. Tell me what to do for
What
20.
to do? Yeah, I think that's one thing we clinicians, when we start a consultation, let us keep the negativity later. We should always do the positive things, what you need to do, and then tell them what not to do. I think that strikes a bell for them.
Very true. That's what I've been doing. I hope I have become a good doctor. I do not know.
Definitely, of course, obviously, no
Yes.
doubts about that. Yeah. So I think that is a wonderful discussion, and I think we have tried to discuss few things which are very, very important in trying to see that we have a strong nation with healthy women and men, so that the human race, as you said, will be healthy. And of course, the concept of health also has to change. A concept of health, as WHO defines, is not just the absence of disease, but it has to be well-being, a sense of well-being. And I think if we follow these simple things, like keep it simple, and I cut the last word, so keep it simple will definitely help us deliver what we want to those who come to us whenever they have any issues. So thank you, Dr. Shekhar, for spending your valuable time with us. I thank our President, Dr. Sunita, for giving us this platform where we can really bring out so many nuances which can be discussed and heard by many of our listeners. And I thank the support team from Gyan Pravah Evangel for giving us this wonderful opportunity. Thank you. Good night. Namaste.
Thank you. Good night. Jai Shri Gurudev.
Jai Shri Gurudev.